Hello, this is Dr. Gay from First Lake MRI, and this is a 16-year-old female who has had pain in her wrists for her whole life, and she has an abnormal appearance here of the distal radius. So this is the radius, this is the ulna, and typically the radius is almost as long as the ulna here, and normally the radius is a more horizontal articular surface, but hers is slanted downwards like this. These are some X-rays. The X-rays show the same slanting downward. We see that the radius is shorter here than the ulna, so an abnormal appearance. If we look on the other wrist, this is the right wrist, she has findings that are not quite as severe. She does have this slanting of the distal radius, but the ulna is about a normal position relative to the adjacent radius here, and there's room over here between the distal ulna and the carpal bones. But on the right side here, things are more severe, and there is narrowing between the ulna and the carpal bones here, and we'll see this a little bit better on the MRI. So, on the MRI scan of the right wrist now, we see that the radius is abnormal. It's slanted downwards instead of being horizontal. The distal radial articular surface has ulnar tilt, and here's the distal ulna. The ulna is longer than the radius here, so we call that an ulnar positive variance. And with that abnormal configuration, we have narrowing between the ulna, and this is the triquetral bone. The triquetral bone also has broadening of the articular surface here. It looks almost like a spur. There's just this developmental flattening and broadening and narrowing of this space. And in this space, the triangular fibrocartilage, little fibrocartilaginous band fits through there, so they get impaction or abutment between the ulna and the triquetral bone here. We call it ulnotriquetral impaction, and they can get associated tears of their triangular fibrocartilage. This patient has some degenerative signal there, but did not see a definite tear. The other thing these people get is proximal migration of these carpal bones. So especially this bone here, the lunate bone, migrates proximally because this is so short. And when it does, it makes this V-shaped configuration of the carpal bones. And this is a congenital condition, it's usually congenital, called Madelung deformity. Again, Madelung deformity is related to abnormal growth of the radius. Sometimes they have bowed radii, and it's usually along the ulnar third of the distal radius here. So towards the ulna, along this ulnar third, the growth plate doesn't grow long enough. It may be related to premature closure. In this patient, we see that this growth plate is closed, and again, this is not grown out as far as it should, so this migrates proximally to fill in that space. Again, this is called a Madelung deformity. It's autosomal dominant, and people usually find out about it when they're late childhood or adolescence, when they become aware of the pain. This patient has known about it their whole life. Sometimes people can have injuries when they're kids too and injure this growth plate. It can fuse prematurely, and they'll have a really similar appearance to this. Well, they get the deformity and foreshortening and look just like this. We still call it Madelung deformity. Now in a side view here, a sagittal view, where we see the distal radius here, normally the articular surface is horizontal. Instead, this is tilted towards the palmar direction. Here's the palm. So this is some moderate palmar tilt. And also the long axis of the carpal bones here. These are the carpal bones are here, and here's the long axis of the radius. So there's palmar subluxation of the carpal bones relative to the radius. And again, that's from the slanting of the distal radial articular surface. And so to recap, Madelung deformity is premature closure or limited development along the ulnar aspect of the distal radius. It causes this ulnar tilting of the distal radial articular surface, and also palmar tilting of the radial articular surface. And because it's short, we get the ulnar positive variance and impaction here or abutment with the triquetral bone, and we get the proximal migration of the carpal bones and this funny V-shaped configuration of the proximal carpal row here. Again, it's typically autosomal dominant, but can be acquired, and it's bilateral in, it says, between 50 and 70% of the cases. And that's it, Madelung deformity of the wrist and forearm.